The Oropouche virus, a previously South American-specific pathogen, has now made its way to Europe, raising significant alarm among health professionals. For decades, this virus, which was first identified in Trinidad and Tobago in 1955, was largely confined to the Amazonian regions of South America. Its nickname, sloth fever, highlights its early detection in Brazil from a sloth blood sample. Traditionally, Oropouche virus was spread through midges, tiny insects, and did not spread from person to person. Historically, the virus has caused mild symptoms akin to other arboviruses, like dengue fever. Patients typically experience fever, headache, and joint pain, but recover within 1 to 2 weeks. However, recent developments have alarmed experts. This year alone, over 8,000 cases have been reported in the Americas, primarily in Brazil, but also extending to Peru, Bolivia, Colombia, and Cuba. Now, the virus has crossed the Atlantic, with confirmed cases in Spain, Italy, and Germany. The most troubling news emerged in July when health authorities reported the first fatalities linked to the virus in nearly 70 years. 2 young Brazilian women without pre-existing health conditions succumbed to the virus, a stark contrast to its usual non-lethal nature. This has heightened concerns about its potential severity and impact, particularly as the victims were relatively young, raising red flags for public health experts. Further complicating the situation is the potential for the virus to be transmitted from mother to child. Recent investigations in Brazil have uncovered cases of fetal deaths and malformations potentially linked to Oropouche virus. This adds a new layer of concern for pregnant individuals and their unborn children. Virologists are also worried about the virus's evolving transmission routes. While no human-to-human transmission has been confirmed, there are increasing fears of possible mother-to-child spread. Additionally, the virus's ability to rapidly mutate, similar to SARS-CoV-2, the virus responsible for COVID-19, could result in more virulent strains. This genetic adaptability, which allows for rapid mutation and potential gene swapping, poses significant challenges for controlling its spread. The driving forces behind this outbreak include climate change, deforestation, and increased human and animal movement. These factors have altered the environments where vector insects thrive, enabling the virus to spread beyond its traditional forested habitats. Urbanization and deforestation, particularly in Brazil, have created new breeding grounds for midges and other vectors, further facilitating the virus's spread. Currently, there is no vaccine or specific treatment for Oropouche virus. Health officials recommend avoiding insect bites through repellents and protective clothing, especially for travelers heading to affected areas. Increased surveillance and research are crucial for developing effective control measures. While the virus has not yet caused a global pandemic like COVID-19, its spread to new regions and the emergence of more severe cases underscore the need for vigilance. The European Centre for Disease Prevention and Control notes that while the risk of widespread transmission in Europe is currently low, travelers to affected regions should take necessary precautions. Continued research and public health measures are essential to managing this emerging threat and protecting global health. Stay subscribed for more videos.